Hello, fellow classmates. My name is Juliet Cha, and my topic is about the flaws in the healthcare system. And the reason why I chose to talk about this topic was largely because I am currently on the long and arduous journey that comes with being an aspiring medical student. And throughout that journey, I have been asked the question, what is the responsibility of a health professional a lot? And what I had initially thought was that a doctor should be able to properly diagnose an illness and then be able to send the patient on their way. But I found through various psychology and science and public health classes that there was a whole lot more to think about when it comes to the health of a person. For one, not only do you have to think about what the illness is, you also have to be able to assess how, when, and where the illness came to be. You also have to think about what you will do so that this patient does not have to keep coming back for the same problems and the same illness over and over again. Essentially, the responsibility of a health professional is in making the patient feel comfortable, safe, and most importantly, informed about their health situation. But when looking into the actual US healthcare system, there are incredible flaws that impinge on these duties that should just be natural. In fact, the healthcare system has flaws that are basically taking advantage of the American people. And one of the biggest flaws is that the US spends the most money on healthcare than any other country, but the health outcomes are still not up to par with almost any other developed country. For just healthcare alone, Americans spend approximately $1.7 trillion annually, yet we live shorter lives in the end. And the American life expectancy was estimated to be approximately 79.3 years, which isn't actually that bad, but Canada, in comparison, spends less than half of that amount that the US spends, and the life expectancy is higher at 82.2 years of age. The medical industry has seemed to have transformed into a business that focuses more on the financial rather than the overall aspects of the patients, which is supposed to cater towards, which is a huge issue. Nowadays, most doctors seem to be required to maximize on practice revenue rather than focusing on the outcomes of the patients. This includes having excess administrative costs or inflated prices on equipment and technologies. And this is not even to mention, like, with Big Pharma, which monopolizes the whole prescribed medication industry and is essentially making costs rise exorbitantly as opposed to, just having doctors prescribe the generic medications, which can make all of the costs, visiting the hospital up to 100 times less. Doctors don't have the time in each and every consultation to be able to explain everything about your illness because they, one, have too many patients to look at, and two, make more money based off of the amount of turnover that they have. Doctors don't have the time to be able to prevent all the aspects of your life that could possibly be exacerbating your illness. So what happens to you is that your illness reoccurs and then you end up back in the hospital because you don't understand your illness and why it's happening to you. And so your costs just continue to rise and rise. The US medical system, while intended to help the public, is looking in the completely opposite direction, and it's starting to harm us. What I'm trying to get at with this presentation is to address that these flaws are all too real and that there needs to be a change if you want to see better health outcomes for the amount of money that we are putting into this system. And as an aspiring doctor, I would like to avoid treating my patients as if they're paychecks because everybody deserves treatment to their ailments. I mean, isn't that why medicine was created in the first place? I mean, isn't that what my responsibility should be as a health professional? I want to be able to change this system that we have right now, and now the question is, what can we do to change and improve all of our lives?